Some people will soon be able to get another shot of the bivalent COVID vaccine,
including seniors ages 65 and older and people with compromised immune systems.
The Food and Drug Administration authorized another dose of the bivalent boosters today. UW Health's Chief Quality Officer, Dr. Jeff Pothof, is here with his weekly visit. Welcome back.
Hi, Dr. Pothof.
Good to see you guys.
What do you think the FDA thinking is here?
Yeah, so the reason that they did this is we know that with either vaccines or natural immunity, it's pretty decent shortly after you either got the vaccine or you got sick, but then it starts to wane and your chance for more severe disease starts to go up. And this is particularly true in those who are elderly because their immune systems aren't as strong, and those who are immunocompromised. And what we don't want to wait for is to learn that people's current immunity or the vaccine they got back in September isn't good enough and see people in the hospital. At the same time, we don't have conclusive data on exactly when people should get this booster. So I think that's where the FDA today said, you know what, if you're 65 or older, at 4 months, if you get a booster, there's not harm to that, and that probably covers you as that immunity starts to wane. And for those that are severely immunocompromised, they have a poor immune system, they can get it 2 months after that initial vaccine to really provide that level of protection against severe disease before it starts to drop off.
But do you still have to have had all of the previous regimen of vaccines?
So that's the other thing that changed, is they're no longer requiring the 2-dose series to start. And the reason behind that is that they're looking at people and they're saying, you know what, either you've been vaccinated and you have some immunity from that, or if you weren't vaccinated, it's almost guaranteed you've come across COVID already. So everyone has essentially been initially inoculated with COVID-19, either through infection or vaccine. So now you're just kind of on to boosters.
And we've seen a little bit of a jump in cases. I mean, we all know somebody who has.
Yeah, anecdotally, it seems like a lot of people are suddenly testing positive again and getting sick.
I think it's fair. Now, like the data, it's kind of hard to interpret sometimes because there's home testing and things like that. If we look in the health system and people who've called in with positive COVID tests, we did see a bit of an increase, and we're not sure exactly why, but there's some thoughts that it might have been related to spring break, which recently happened. Folks go and they're usually mingling with a whole bunch of people when you're out on vacation. Some of those folks will get COVID, and then maybe now as we're getting past spring break a little bit, we'll see that come down again.
And the weather's getting warmer as well. We're getting outside.
And maybe it'll go back up.
No guarantees, is there?
Who knows?
I want to go back to the bivalent. Why 65? Why not like 50 or?
Yeah, I think it's just a matter of picking a cutoff and knowing, you know, people who get to that 65 and older, their ability to generate that immune response is going to be less than someone, say, in their 50, 55s. During COVID, there were some studies looking at these different age brackets, and there did seem to be a bit of a difference in that 60, 65 age group compared to folks who are younger.
And is this sort of the FDA paving the way for these kind of vaccines to become like the flu shot?
I think absolutely, especially with kind of getting away with the requirement for 2 doses to start. We get into a situation where at some interval, and it could end up being yearly. It doesn't mean that forever these vaccines will be at a more frequent interval. Singular annual COVID vaccine, just like you do with flu.
So if you're 65 and over, you just call your pharmacy, or how do you go about it?
Yep, however you went about and got your last dose, you could do that. But pharmacies, health systems, things like that, I assume soon, within days, they'll be able to administer these doses. They have them. It's not a new shot. It's just a new group of people who are eligible for them.
Okay. Keep a lid on the thing. That's the idea at this point. Doctor, good to see you again.
Thanks,
Same.
Jeff. Good to see you.
Well,